Ever since my daughter has gone to class 12, she has been missing her periods, has severe acne, and gets panic attacks. She keeps crying the whole day.
I feel worthless, unwanted. I'm fat. I have lots of body hair. I'm not as attractive as my friends. Nobody follows and likes me on Instagram or Facebook. My parents also don't understand this.
As we all observe September as the World PCOS month, today let's talk about something which is less discussed, less spoken about, but is seen with almost 50% patients of PCOS. So what if the extreme stress and bad mood you've been carrying throughout the day explains something else? Have you thought about how PCOS could affect person's mental status and emotional health? So hello everyone, this is Dr.Anjali Kumar, once again bringing greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. As gynecologist, I have seen practically 50% of my patients of PCOS have issues of stress, depression, anxiety, palpitations, panic attacks, brain fog, sleep disorders, eating disorders, cravings, and a lot more. Did you know women with PCOS are 3 times more likely to have depression than those without PCOS? So today I have with me once again senior consultant psychiatrist and founder Manasthali, Dr. Jyoti Kapoor. She is our mental health specialist at Maitri. So welcome Dr. Jyoti once again to Maitri.
Thank you so much Dr. Anjali, and hello everyone. So good to be at Maitri.
Stress and PCOS. What comes first? As many as 27 to 50% patients of PCOS report stress. So does the stress cause PCOS or the PCOS which causes the stress? What came first, the chicken or the egg? Till now, it is assumed that PCOS is just a disease of hormones, bad eating, sedentary lifestyle. But picture abhi puri nahi hai. There is a lot more to this story. In my practice, I have seen that the story of PCOS starts typically when a girl is in class 10th, class 12th, high school, or has just gone to the hostel. Pressure of studies, performance, career, relationships, the pressure of looking good in the era of Facebook and Instagram and DPs. So can stress cause PCOS?
Well, I totally, completely agree with you, Dr. Anjali. And in fact, many a times women who come to me for anxiety or depression often give the history of a pre-diagnosis of PCOS. The connection between stress and hormonal issues has been known, and we understand that stress causes high levels of cortisol, which further impacts insulin and gonadotropins, leading to signs of PCOS.
So in my practice, I really feel it is the stress which starts the initial story of PCOS, and not just in young girls. I've seen what is actually known as superwoman syndrome. You know, women who are into their middle age. Today the women are actually managing so many portfolios, and at none of these situations they're actually taking a back seat, managing their careers, families, the kids, and that too at the highest level of perfection. Now this has its own perils. But can PCOS also cause stress, complicating the story even further?
Definitely, because it is a vicious cycle. See what happens. Primarily, you are under stress, and this is affecting your lifestyle. Maybe that is one of the reasons why your hormones are going haywire, you're eating too much, you're developing, obesity. Now the PCOS has kicked in, and what is it doing? You have started missing your periods, you have started getting acne, you have started getting hair, and all of that in a world which is so bent upon physical features, how you look, like you just mentioned, we are the DP friendly population today. All of that has an additional stress, and considering that PCOS actually affects the young adolescents and young women who are are in that phase of life and they want to look their best. So that somewhere affects their self-image, their ability to see themselves as womanly or feminine or attractive, and that causes the cycle to continue, and it becomes a vicious cycle.
Yes. I've seen even in women who are trying to conceive, women who have infertility, the stress of that infertility, when people are telling them it is your PCOS, it is your period which is the culprit, that stress also complicates the matters even further. Missing your periods and just getting your periods unexpectedly at a time when you least expect it also adds to the problem. Also, I've seen stress associated with the medications. Most of these patients are on long-standing OCPs, contraceptive pills, long-standing other medications. The chronic nature of the disease, people are constantly or rather often told that this is a disease which is not going to leave them forever. So this adds to the stress. So yes, it's actually a chicken and an egg story together, where the stress starts the story of the PCOS and PCOS then further adds to the stress. I've also seen in my clinical practice that many young girls or even middle-aged women who have PCOS have lots of anxiety issues. They even complain of palpitations. I actually remember a young girl having a panic attack in the OPD. So what's your take on that?
Yeah, right. And like we mentioned that, there is a whole lot of comorbidity between PCOS. Almost 50% of patients with PCOS tend to have a clinical anxiety disorder or a clinical depressive disorder. But apart from that, it has been seen that depressive symptoms are independent of PCOS symptoms also. So depressive disorders do tend to co-occur with PCOS, and they need to be treated like clinical depression. What we call brain fog is basically a confusional state. So whenever we are stressed or overwhelmed, there is a high level of stress chemical in our system. And at that point of time, we are in that acute stage of flight or fight, and when that is happening, you can't really concentrate on anything. So it seems like I'm lost, or I'm confused, or I don't know what's happening to me, and that is generally what is experienced as brain fog.
A lot of patients also have eating disorders. In fact, eating disorders then complicate the matters even further. Either they are just not eating because they are desperately trying to lose weight, or they're eating too much, what is known as bulimia, and they have all kind of cravings.
So there are neurochemicals like leptin, ghrelin, orexin that we have identified that are disbalanced when there is PCOS, and they lead to lowering of satiety. And when we are feeling low, there is a tendency to
compensate it by eating.
And now when you're feeling stressed out, you want to go to that tub of ice cream or that comfort food because it makes you feel good. So what do we need to do about cravings or eating disorder is a very, there is a particular structure to the treatment of that. And first thing is to be able to identify that craving is not hunger. That if you are craving, it's not for food that you're craving, you're craving for something else. And once we are able to identify what is it that I'm craving, I am craving, wanting to get out of this unpleasant state, wanting to, feel more relaxed or happier, do not want to feel the kind of stress or anxiety, then there are other options to do it rather than, going for that, piece of pizza or that tub of ice cream.
So also, many of the patients with PCOS have sleep issues. In fact, last year we did a video on sleep and PCOS, and now we have enough research talking about how PCOS patients report so many sleep problems. They're not able to sleep, they have erratic sleep timings, their sleep is not peaceful, they get nightmares and so many other things. Now, whether it is a lack of sleep which leads to PCOS, or the PCOS per se causes the sleep problems. But now we know that high cortisol levels, they interfere with the melatonin cycles. Now this is again the buzzword on the internet, everybody's asking the doctor to give the melatonin tablets. So yeah, would you like to explain that to the people?
No, definitely. And like you already know, Dr. Anjali, that our hormonal cycles are based on our circadian rhythm.
Yep.
And our circadian rhythm, that is our body clock, or our sleep-wake cycle, it is dependent upon these chemicals we called melatonin. The newer ones like orexin are also being identified. But what is most important is the natural rhythm of the body, which is in keeping with the solar cycle. That is, with the light that enters the eye with the sun, there is release of melatonin and you start feeling active and your body starts producing the hormones that are needed. And then as the light subsides, the hormones, your certain hormones are getting shut off, others are becoming more prominent. Second important aspect is that depression and anxiety themselves are associated with sleep related disorders, because these are the first symptoms. When somebody is tense, stressed or depressed, they will have sleep related issues. So both of them do tend to co-occur, and treating one will definitely help in the treatment of other.
So the simple thing is, never compromise on sleep. At least make that effort of sleeping on time. When people tell me, no ma'am, I sleep at 2 o'clock and get up at 10 o'clock, isn't it that enough? I say no, this is not in accordance with the circadian rhythm. It's a very simple thing, but never ever compromise on your sleep. So when to seek help if you think that you could be having some mental health issues?
Yeah, and like you already mentioned that mental health has been a taboo in our society. So usually we would like to go to a gynecologist or a physician, but going to a psychiatrist would be really, really threatening.
So I think it's very, very important for a gynecologist also to understand that the PCOS is probably arising somewhere else. So we need to have, the so-called multidisciplinary treatment wherein a psychiatrist has to be part of the team. That's very, very important.
And then the telltale signs that you can see in adolescents usually at this stage is that they, start becoming socially withdrawn. They might become irritated, angry, might start, resisting everything. Their overall, sleep-wake cycle gets disturbed. They're not eating well, or they're eating too much of junk food, don't want to eat, food at home. Then their academic performance may start deteriorating, and they might, lose concentration. Usual interests are lagging behind.
One small word of caution which I would want to probably give from your side is that never ever self-medicate. I know these days you have your friendly chemist who are ready to give you anti-anxiety or even antidepressants, but please never take these medications without the prescription. And
I would like to add to that this point also, that sometimes you're prescribed medication and then you don't take them because the chemist said no. So kindly follow the advice of your doctor rather than anybody else, or take a second opinion.
Yeah. So what are the red flag signs when the child or maybe the girl needs to be taken to a mental health specialist?
See, the most unnerving thing in psychiatry is the suicidal ideas. And nowadays we are seeing a lot of self-harm behavior in young children. So that's an important point. The other thing is anorexia nervosa. Again, like you mentioned, eating disorders are common. Now, lose your weight is something that we often tell them, and in the process they might become obsessive about it and stop eating all food, not just the junk food. So we need nutrition, and we are not taking appropriate nutrition. That's a bad thing too. It in itself, anorexia leads to a catabolic state, which leads to amenorrhea. And the third thing is that aggression and agitation that you might see, we generally start blaming the child for it, but there is a cause for everything.
Few self-care tips which the family or the young girls can do. What can they do at home to take care of all these symptoms?
Right. So it's very important to first acknowledge and accept that everybody has some or the other problem. Nobody is perfect. And when we try to follow a role model, or when we try to follow somebody on social media, we are missing out the point that for that perfect picture a lot of work went in. It's happening to us also on a daily basis when you're doing it here. So it's important to acknowledge and accept that there are going to be imperfections, and we are beautiful despite that.
Yes,
So,
each one of us is beautiful in our own way.
Yeah, and then we need to be able to have a balanced sleep-wake routine, healthy diet, proper sleep-wake cycle, and exercise are the three most important things on which proper health is based. Whether you have a problem, health-related illness or not, because if that is not working properly, that is not going on properly, then something or the other will happen. So it's very important. So it's part of self-care. So if somebody is, eating well, it's not like you are, becoming obsessive. You're taking care of yourself. If you're sleeping adequately, you're taking care of yourself.
The me time.
Exactly. And of course, then, little things that you enjoy, following a hobby, pursuing something that you like to do. It doesn't have to be for the sake of getting a medal or, learning a skill to be used as a professional, but just because you enjoy it. So I think it's very important to focus on what makes you happy and do it on a regular basis.
And our society still frowns upon the idea of visiting a psychiatrist or a psychologist. So let me affirm and remind you all that health includes not just the physical health, but mental, emotional and social well-being too. Remember, you are not alone in this journey. So today, if you found this video and information relatable, please do not forget to like, share and comment to Maitri. And thank you very much, Jyoti, once again to be with us and educating our viewers on such an important topic. Thank you, and we look forward to hosting you once again.
Thank you so much, Dr. Anjali, and thank you everyone. Take care of yourself.